Hi, I'm Dr. Ivan Pitman. I'm a consultant clinical neuropsychologist. I'm currently the clinical lead at Redford Court, which is the unit based in Liverpool belonging to the Brain Injury Rehabilitation Trust. And so what we've done at Liverpool is taken the time to really develop those services from assessing people either at the Walton Centre in Liverpool or even at the Royal Salford over in Manchester, and trying to transition those people out of medical care into a community-focused rehabilitation and then returning those people back home to their families. One of the things that I first came to meet the Brain Injury Rehab Trust through their conferences that they hold every 2 years. And I think you can see from those conferences that actually BIRT has a real desire to push forward the neurobehavioural model and successful neuro rehab across nationwide. Over that time, BIRT's grown, so it's developed units in Wales and Scotland, as well as, again, further units in England. So there's a real desire on the part of BIRT to make sure that it has effective rehabilitation nationwide. And it really is that kind of sense of clinical governance, which is one of the things that sets BIRT apart from other services. So there's an immense training package that's provided not only for the clinical team but also for the RSWs, our support workers. And those support workers are some of the unsung heroes really of each of the service, and they're the individuals that are following the clinical guidelines that are written down by the clinical team, and they're the ones implementing lots of that kind of neurobehavioural approaches and making sure that rehabilitation is kind of provided on a not just a day but to day basis, but actually a minute to minute basis. One of the things that was refreshing about coming to work with the Brain Injury Rehabilitation Trust really was that ability to free myself up from some of those constraints that exist naturally within the NHS. I was afforded the opportunity to be a little bit more innovative. I was afforded the opportunity to be within bounds or within clinical governance to actually be a bit more of an independent thinker, and whilst understanding and appreciating the competencies and the limits, there's always the opportunity to put forward fresh ideas and fresh approaches, and that's kind of paid dividends in some of the developments that we've managed to achieve at Redford Court. I think one of the things that's quite unique within BIRT really is the ability to recruit and retain quite a wide range of individuals with a huge pedigree behind them. You can think about some of the research that's been presented, not just nationally within this country, but internationally, from using assistive technology to the approaches of mindfulness, not only with service users, but also with a staff group. And then, again, just looking at the range of individuals that we've had engaging in research partnerships with the Trust, and also leading us at a director level. So when they first come into the residential units, they're often engaged in a more of an assessment setting. And that's where the multidisciplinary team starts to look at their needs within that time of their lives and starts to plan the goals and the aims and the focus of the rehabilitation whilst they're with us.